You are more than your brain injury. That's a theme during this Brain Injury Awareness Month. Let's welcome Kyle Hopfensperger, physical therapist with Trident Head Injury Support Group, and Travis Richardson, a brain injury survivor. Gentlemen, it's great to have you with us.
Thank you.
So Travis, why don't we start with you, and maybe you can explain what was the injury that you sustained and what was the result of that injury?
Sure. So my brain injury occurred in Flagstaff, Arizona. It was while I was going to Thunderbird School of Global Management to get my MBA program, and I was a member of the rugby team. And every year the rugby team had a big regional tournament that they went to in Flagstaff. And so this was my second year in this tournament. And I second year playing rugby, and I was pretty confident, and I was, just sort of overly confident, and just happened to dive in for a tackle, and I dove in with my head first, exactly as it teaches you not to do, and took a knee to the skull. And I was very fortunate in that there was a lot of staff, a lot of emergency medical staff on site, and as soon as they saw me, they said he needs to go to the hospital immediately. And I think that decision allowed me to go get medical treatment. I was on the operating table within an hour of the hit, and that immediate care is the reason I've been able to sort of have the recovery that I've made so far.
I mean, talk about immediate. If he did not have that immediate attention, Kyle, can you explain what the circumstances may have been?
Yeah,
otherwise?
his brain injury could have been a lot worse than it was. He could have had a lot more long-term effects, a lot more long-term disabilities or impairments from that hit to the head that he had. Getting
onto that emergency operating room table immediately helped to alleviate any kind of long-term damage. But when you woke up from that surgery and in the weeks, months, and years afterwards, what was physical therapy like? What did you have to do to kind of get back to feeling like Travis again?
That was a long road. It started with inpatient rehab, and there was a couple weeks of that in Flagstaff, and then I progressed out of that into outpatient rehab. I couldn't walk on my own. I had to have a wheelchair, and I had trouble speaking. I had, I couldn't remember anything at all. Over the course of those many months, I began to progress much better. And I was eventually able to get back into school and go back to finish my MBA program the following year.
Oh, well, congratulations on that. Now, there are two types of head injuries. Can you explain what those are, two types of brain injuries?
Yeah, there's an acquired brain injury, so something within the body has caused brain damage. This could be a blood clot that causes a stroke, it could be a lack of oxygen for a certain amount of time, or an infection. And then there's a traumatic brain injury, so a blow to the head in a car accident, rugby accident, any sort of outside force that hits the head and causes brain damage.
And between those two types of brain injuries, can they manifest the same symptoms, the same types of issues?
Yeah, a lot of times you'll see physical impairments, muscle weakness, memory issues, cognition issues, trouble speaking. That's called aphasia. Either someone that can't get the words out or they can't understand the words that are being processed in the brain.
So how important is your job, getting people back on their feet, back talking again and remembering things?
Yeah, it can be a very long process, and people will heal differently. Some people are left with long-term impairments. They might need some sort of device like a cane or a walker, or they'll get around in a wheelchair, whereas other people, depending on how quickly they sought medical treatment or just how much the brain tissue was damaged, they might progress differently, and it just takes a very long process, and you really don't know until you start digging in. A lot of people will go to inpatient rehab and then outpatient rehab. I specifically work in home health, so we see that a lot in the home as well.
Yeah, so people also need to be vocal about it. You don't necessarily need to hide it, but others who are learning about someone else's brain injury need to be patient and to be helpful. And you, speaking of help, you have a monthly gathering. Can you tell us just briefly where and when that's being held?
Yeah, so it's the Trident Head Injury Support Group. It's a group that's been around since the early 80s. It was started by a nurse whose son had a brain injury from a car accident. It's taken different forms throughout the years, but we meet on the first Tuesday of every month. Currently, we're meeting at a nonprofit co-op downtown called Ripple on
Great.
East Bay Street.
Perfect.
And we have a Facebook group and then a website too with all of the information. And we try to do different activities throughout the year, whether it's picnics, movies, shooting pool, that sort of thing.
Well, we're going to make sure to put that up on our screen. I want to thank you both so much for joining and sharing your story with us, Travis. We really do appreciate that. We're back in 2 minutes.